Responding to a 56-year-old female with chest discomfort and tightness.
PPE is on. Is my scene safe?
Yes, your scene is safe.
I have one patient, nature of illness, chest discomfort. I'm going to call for advanced life support, and at this time I will not be considering ceasefire precautions. As I arrive on scene, the general impression of my patient is that she is in poor condition, having some labored breathing. Hi, my name is Larry. I'm an EMT. Can I help you today?
Yes.
What is your name?
Darlene.
Okay, Darlene, and how can we help you today?
It's just hard for me to catch my breath, and I have this sharp pain in my chest.
I'm sorry to hear that. We'll do what we can to help you. Can you answer some questions for me?
Yes.
Where are you right now?
Home.
What month is it?
June.
And what were you doing when this all started?
I was mowing the lawn.
Patient is A&O ×4 and her airway is patent. I hear no obvious signs of respiratory distress. I'm going to put her on 15 liters per minute of O2 via non-breather mask and titrate that to effect using an SpO2. Can I see your wrist, Darlene? Checking your pulse, it is strong and regular. Skin is pink, warm, and dry. I see no obvious signs of bleeding.
Pulse is weak and rapid and skin is cool and clammy.
Patient is high priority and we're going to transport her as soon as we can, while treating for shock with O2, maintaining body temperature and position of comfort. So Darlene, tell me about what you are feeling. Did it come on fast or slow?
Slow.
Has it gotten better or worse? Anything that you can do to help it?
It got better when I came inside, but then has just gotten worse since then.
Describe what you were feeling.
There's a pressure in my chest, like a stabbing pressure.
Are you feeling anything anywhere else in your body?
Yeah, it's going up to my jaw, and there is a dull pain in my back.
On a scale of 1 to 10, 1 being no pain and 10 being the worst pain you've ever felt, where are you?
About an 8.
And what time did this start?
Like an hour ago.
Do you have any allergies at all? Like food, insects, medication?
No.
Are you taking or prescribed any medications, including supplements, over-the-counter meds, or recreational?
I take a daily aspirin, and I was given nitro by my doctor, but I've never taken it.
Do you have the nitro?
Yes.
Did you take your aspirin already today?
No.
You have nitro and you take aspirin. So what do you have going on with your heart?
I had a minor heart attack about a year ago.
Okay. Any other medical conditions, concerns, diabetes, cancers, recent surgeries?
No.
When was the last time you ate?
This morning.
Okay. And now to get personal about your bowel movements. How have they been? Normal?
As normal as they usually are.
You said you were mowing the lawn when this started. Nothing else weird or different happened around that time?
No, just mowing the lawn.
At this point, I will do my secondary assessment, focusing on cardiovascular system and pulmonary, looking at SpO2 and listening to lung sounds.
SpO2 is 94% on oxygen. Lung sounds are clear.
I'm also going to keep an eye on her neurological and psychosocial state, making sure she stays calm and as comfortable as we can make her. Okay, Darlene, now I'm just going to take some quick vitals, like blood pressure, so just relax the best you can. Blood pressure is 124/78, pulse of 70, respirations of 12.
You get a blood pressure of 196/92, pulse 110, and respirations of 20.
Okay, what about glucose and temp?
Blood glucose of 88 and temperature of 97.6 degrees Fahrenheit.
I'm going to call medical control and give them my field impression. I have a 56-year-old female who has a history of heart attacks and has current blood pressure of 196/92 and is experiencing chest pain. I would like to administer 325 milligrams of aspirin, chewable, and 0.3 milligrams tablet of nitro sublingual.
Go ahead as per protocol.
Okay, Darlene, go ahead and chew up this aspirin, and once that is done, I will have you put one of these tablets under your tongue and try not to let it dissolve. Try to let it dissolve and not swallow it. During transport, we will reassess ABCs, LOCs, vitals, and interventions to see if the patient is improving or declining. I will give a handoff report to the receiving EMS unit or charge nurse at the ED, telling them, this is Darlene. She's 56 years old. She has been experiencing some chest pain. She has a history of a heart attack a year ago, and We gave her a dose of nitro and 325 milligrams aspirin. She seems to be doing better.
Is there anything else you would like to do?
No, I am done with my assessment.
Good.